Can Akitas be trained to be therapy dogs? Akitas are known for their strong and independent nature. Originally bred in Japan as hunting dogs, Akitas have a reputation for being protective and loyal to their families. With their distinctive appearance and powerful build, Akitas might not be the first breed that comes to mind when one thinks of therapy dogs. However, with the right training and socialization, Akitas can indeed excel in the role of therapy dogs. Therapy dogs provide comfort, support, and companionship to individuals in various settings such as hospitals, nursing homes, and schools. They are specially trained to be calm, well-behaved, and responsive to the needs of those they interact with. These dogs can bring great joy and emotional healing to people from all walks of life. While Akitas may not possess the innate friendliness and sociability of some other breeds commonly used as therapy dogs, their unique traits and characteristics can make them excellent candidates with proper training. Let's explore some of the reasons why Akitas can be successful in the therapy dog role. Firstly, Akitas are known for their intelligence and trainability. Despite their independent nature, Akitas are quick learners and have a strong desire to please their owners. This makes them receptive to the training required to become well-behaved therapy dogs. With consistent and positive reinforcement training methods, Akitas can learn to respond to commands and behave appropriately in a variety of situations. Secondly, Akitas have a calm and composed demeanor. Despite their size and strong physique, Akitas are generally known to be gentle and composed. This temperament makes them suitable for therapy work, as they can remain calm and composed in stressful or emotionally charged environments. Akitas are often described as having a dignified presence, which can have a soothing effect on individuals they interact with. Another important characteristic of Akitas is their loyalty and devotion to their families. Akitas form strong bonds with their owners and are known to be protective of their loved ones. This loyalty can be channeled into their therapy work, where they can exhibit unwavering dedication to providing support and comfort to those in need. The bond between an Akita and their handler can be a powerful tool in therapy sessions, as it enhances the trust and connection between the dog and the individual being assisted. It is important to note that not all Akitas will be suitable for therapy work. Each individual dog has its own unique temperament, and it is crucial to assess their suitability for the role through thorough temperament testing and evaluation. Akitas with aggressive tendencies or extreme shyness are not suitable for therapy work and should not be forced into such a role. Additionally, early socialization is essential for Akitas to succeed as therapy dogs. Exposing them to a wide range of people, animals, and environments from a young age will help them develop the necessary social skills and adaptability required for therapy work. By providing positive experiences during their socialization period, Akitas can learn to be comfortable around strangers and remain calm in unfamiliar settings. In conclusion, while Akitas may not be the first breed that comes to mind when thinking of therapy dogs, with the right training, socialization, and temperament, they can excel in this role. Their intelligence, calm demeanor, and loyalty make them well-suited for providing comfort and support to individuals in need. However, it is important to assess each dog's suitability individually through temperament testing and ensure proper socialization from an early age. With the right approach, Akitas can indeed be trained to be successful therapy dogs, bringing joy and emotional